Welcome to R and Osce learning sessions. Today we will go through Station 6 Clinical Skills and Updated Version. Imagine you are seated in front of the screen. Take a moment to focus and read the scenario carefully. Avoid approaching it with a preoccupied mindset or relying on what you have previously studied or heard. Always expect some changes or possible changes and treat or consider it as a new case. You are required to perform wound dressing while strictly following infection control policies and aseptic techniques. As usual, prepare and arrange all articles on the trolley in an organized manner. Here, you are a registered nurse in a surgical ward. Your patient is so and so. He had undergone an exploratory laparotomy 3 days back as he had presented with an acute abdomen. His surgery was uneventful and he is stable right now. He has no significant history past illness. His wound is scheduled for dressing change today. You have taken his vital signs and findings were within the normal ranges. He has pain and discomfort and the morning dose of analgesics was administered 1 hour before. Our recommendations are: you have to perform dressing change while adhering to standard infection control and wound care protocol. Assess the wound and verbalize the findings only. Only here you have to verbalize the wound assessment and your references accordingly. As always, knock the door, look around for scene safety, ensure patient privacy, and perform hand hygiene before approaching the patient. Here, if needed only, you can say, okay, I'm back for your procedure right now. Let me prepare the trolley first. Here, as you all know, you are required to perform wound dressing. The only thing is, you have to follow infection control policies and aseptic techniques. As usual, prepare and arrange all the necessary articles on the trolley in an organized manner. Like, as you all know, as they already mentioned, dressing trolley is already clean. Even if it's clean, you have to take an alcohol wipes and wipe it in a zigzag manner from the farthest to the nearest. Clean the top shelf followed by the bottom shelf. Obtain the dressing set from the rack and check its expiry and verbalize it and keep it in the lower section. Take the dressing pad, check its expiry, keep it in the lower section. Obtain the normal saline, check its expiry and keep it in the lower section. Take the paper bag, or it's better to place yellow bin. You have to look around for the yellow bin and keep it beside you. Place the micropore and scissor also in the lower section. Finally, place the hand sanitizer nearby. It's better to place a yellow bin instead of paper bag. If you are comfortable with that, go on with this paper bag, but it's better to place yellow bin near to you. Moving further, okay, let me unbutton your shirt. I can see the old dressing. I'm going to remove your old dressing. I will do it gently. As I told already, avoid approaching your patient with a preoccupied mindset. What you have previously studied or what you have heard, always accept possible changes and treat always it as a new case. Okay? So you don't know what's going to see. I'm going to remove your old dressing. I will do it gently. Okay, this dressing is soaked with pulse. I can see yellow discharges and I will throw it in the paper bag right now. Okay, this is a midline abdominal laparotomy incision. It measures around so and so centimeter and it's closed by so and so, either by a staple or intermittent suture. And this wound appears red and swollen. I can see slight drainage and pus, yellow drainage present, but there is no foul smell, but minor wound dehiscence is evident. and the surrounding skin appears edematous and slightly erythematous. This wound shows some signs of infection. Okay, I would like to inform the treating doctor regarding the signs of infection present, and I would like to request to send a wound culture specimen in order to identify the which organism and to plan the treatment accordingly. So this step or this assessment you have to verbalize, it's mandatory. Clearly mentioned in the recommendation part, you have to verbalize only the wound assessment and what's your reference or what you planned or what is your reference according to this patient. Okay, I'm going to perform hand hygiene. Okay, I have done that. To perform dressing, I will arrange the articles from lower compartment. Okay, I'm going to open the dressing tray in a sterile way. I can see yellow forceps on the top. With the help of yellow forceps, I'm going to take the drape out first. Okay, here we go. Followed by 2 blue forceps and cotton balls. Okay, in order to extend my sterile field, I am taking off the drape using yellow forceps and just spread it below the wound. Moving further, I am going to take the dressing pack and open it above the sterile field. Okay, I will take the normal saline and pour it on the compartment. Okay, with the help of 2 blue forceps in each hand, pick up the 3 cotton balls, dip them in the saline, squeeze out the excess and place them in a separate compartment. Okay, again I have to perform my hand hygiene. That's done. Okay, I'm considering my right hand is patient hand and left hand is clean hand. Okay, for your better understanding, I'm verbalizing all those things. No need to verbalize. If they mention that you have to verbalize each steps, you can follow, but here they mention that no need to verbalize unnecessary thing, like what you're doing you have to do it, and only the thing is you have to verbalize the wound assessment and your reference. Okay, here I'm considering my right hand is the patient hand and left hand is clean hand. Okay, here the entire scenario no need to verbalize, you have to perform by following or by strictly adhering to the infection control policy. Okay, using the clean hand, pick up the squeezed cotton ball and gently hand it over the patient hand. Clean the center of the wound from top to the bottom, then discard it. Take another cotton ball, clean hand to the patient hand, farthest side, top to the bottom, discard it. Take another ball with the clean hand it over to the patient hand, clean the nearest side from top to the bottom and discard it. Take another dry cotton ball with a clean hand it to the patient, gently clean the center of the wound from top to the bottom and discard it. Take next dry cotton ball with a clean hand, pass it to the dirty hand and clean the farthest of the wound from top to the bottom, discard it. Finally, take another cotton ball with clean hand it to the patient hand, gently clean the nearest side of the wound from top to the bottom and dispose it. Once done, okay, let me cover your wound with a dressing pad directly over the wound in a sterile way. Okay, let me fix it properly by using the scissors and micropore. Okay, once done, throw everything into the yellow bin, cover the patient appropriately and perform hand hygiene. Here, I told you already, follow the proper steps for wound cleaning. Begin by cleaning directly over the wound, then clean the areas farthest from you, followed by the nearest areas using a top to bottom approach. After the procedure, dispose of all the used material in the yellow clinical waste bin and perform hand hygiene. And always avoid making critical errors. Read the scenario carefully and any provided key points you have to read thoroughly. Remain confident. You can complete the task within the 6-minute time frame with consistent practice.